the most important thing you can do to prepare for medical school is not what you might think. I'm not going to sit here and tell you that you need to join a research lab or that you need to do these extracurriculars like EMT work or some other clinical stuff or do shadowing. And while all of that's important, what I'm going to tell you is actually to shift your focus. I think a lot of people that are preparing for medical school are only focused on becoming accepted to medical school. And they're not focused on something else, which I think is far more important, and that is to prepare to become a great physician. You really want to set the foundation while you're preparing for medical school, not just to be accepted, but to excel. And the reason I say this is because of something I learned while I was taking my EMT class while I was studying as an undergraduate. And on the wall in the EMT class, they had a sign that said, "Don't just focus on passing the NREMT, focus on becoming an excellent provider." And that really stuck with me. And I think it applies to everybody in healthcare, because whether it's the NREMT, which is the exam you have to pass to become a licensed EMT, or, the USMLE exams or the MCAT or whatever exams it is, whether it's for becoming a doctor or becoming a nurse or a PA, there's exams. And while this is mostly focused on pre-meds, I think it applies. You don't want to just focus on passing the exams. You don't want to just focus on getting accepted to medical school. You want to, number one, determine if you really like working with patients because enjoying science classes and enjoying interacting with patients are two completely different things. So select your extracurriculars in a way where you're going to be able to interact with patients. I volunteered in a free medical clinic called Occupy Medical where we work with homeless people uh, at two different locations. We just have a mobile trailer and we provide healthcare services. The doctors see patients, and then as an undergrad, most people are triage. So they will fill out the forms, take blood pressure, give the report to the doctor, and then observe what it's like for the doctor to consult with a patient. I also did a bunch of EMT work where I got to interact with patients in a more direct way, where I was actually the one doing the interventions. And I think, look, a lot of people go into those things because it's supposed to help their application. But I think you should really try to shift your mindset and go into it not just to check a box, but to learn what it's like to work with patients. And this is going to help you out because it's going to give you better things to write about in your essays and to talk about in your interviews. And it's going to be more authentic, you know? If you find yourself doing these things, checking the boxes so that you have a better application, and you're not thinking about, do I really like working with patients? Do I really think it's meaningful to work with patients? Then that's not a good strategy. Maybe you'll get accepted in medical school, but that's not the ultimate goal here. The ultimate goal here is to find fulfillment and to improve the lives of the patients that you work with. I personally think that everyone that's going to medical school should enjoy volunteer work because while that's not, a requirement of physicians, I think it's something that all physicians should do because it's the root of the profession. As a physician, you're supposed to heal people. And, I'm just going to be honest. The way that the healthcare system is set up, if you're working in a big hospital, you're dealing with a big insurance company, you're seeing a ton of people, you can get distanced from that aspect of being a physician, that core focus, which is to heal people. Whereas when you're in a volunteer setting, there's none of the distractions, there's none of the fast pace where you're trying to see patients back to back to back. Instead, you're there with one purpose, and that is to bring healing to people that might not otherwise have access to it. So, first of all, you should enjoy that and you should seek it out if your goal is to become a physician. And second of all, you know, um, it's gonna improve your essays and your interviews. But look, the main purpose of this video, the main thesis of this video, is the most important thing to do as an undergraduate while you're preparing for medical school is to stop focusing on doing everything to make your application better and to start focusing on patient interactions, preparing to become a great provider, and being honest with yourself and saying, is this something that's going to actually bring me fulfillment? Because you're going to witness a lot of suffering as a physician, okay? And you don't want to go into that if you don't feel the hope and you're not motivated more deeply through witnessing that suffering by a greater purpose to help heal those people. That is something you should be deeply honest with yourself about and say, you should try to go places where there's immense suffering. You should try to witness incredibly difficult situations. And then you should say, if this happens to me, in my profession for the next 10 years or 20 years or 30 years or however long, you are practicing, which could well be, the rest of your working years, if you're going to do that. You want to be honest with yourself and say, in the face of this suffering and this adversity that I've witnessed in my volunteer work as an EMT or whatever you might do, um, do I find hope? And do I find meaning in this? Or is it ultimately going to overwhelm me? Is it ultimately going to depress me? Because that is much more important than getting accepted. Getting accepted isn't important, okay? Obviously, it's a requirement if you want to become a physician, but becoming a physician shouldn't be your only goal. Your ultimate goal should be to find purpose, find meaning, and bring healing if your goal is to become a physician. So that's all I've got for this video. If you want to follow me on my journey to becoming a physician, you can click the buttons below the video. And that's all I got. I'll be giving some updates about the cycle soon here. It's pretty early. I've done 3 interviews. So I'll let you guys know about that.